going to be presenting during the, novel therapeutic target plenary session. And I think, it's a really interesting time for headache because we've had so much success with these CGRP targeting therapies. But I think it's important about the fact that patients still have a lot of headache days that are going untreated. And I think what's interesting about that is that those headaches are not treated by current therapies, including the CGRP blockers. And so, I think there's a real need to expand that toolbox. And I think delta-opioid receptors may be one of those promising targets. The nice thing about delta-opioid receptors is that they're related to the opioid. They're within the opioid receptor family and are related to mu-opioid receptors. But unlike mu-opioid receptor activation, they have very low abuse liability, so people don't really find them particularly euphoric, or animals don't tend to self-administer delta-opioid receptor agonists. And they also have, there's my lab as well as many other labs have shown that in preclinical models, they have this anti-migraine-like effect, and using a number of different headache models, including models of acute and chronic migraine, migraine aura, and medication overuse headache, and post-traumatic headache. And then they've also got this anxiolytic and antidepressant-like effect, which I think, considering the comorbidity between headache disorders and mood disorders, could actually be really beneficial. And so, I think there's a lot of promise there. And there's two companies that have recently completed phase 1 clinical trials on their delta agonists. And I think in both cases, they're moving their targets or their compounds towards phase 2 clinical trials for migraine.